When a person is in cardiac arrest, quick action is crucial. The cardiac chain of survival describes 5 actions that, when taken, increase a person's likelihood of surviving cardiac arrest. You have a major role in completing the first 3 actions. There is a cardiac chain of survival for adults and one for children and infants. Let's look at the adult cardiac chain of survival first. The first link in the cardiac chain of survival for adults is recognition of cardiac arrest and activation of the Emergency Medical Services (EMS) system. The sooner you recognize that a person is in cardiac arrest and call 911 or the designated emergency number, the sooner advanced medical personnel will arrive. Early CPR is the second link. CPR helps to circulate oxygen-containing blood to the brain and other vital organs, helping to prevent brain damage and death. The third link is early defibrillation. The electrical shock delivered by an AED may restore an effective heart rhythm, significantly increasing the person's chances for survival. The fourth link is early advanced life support, which is provided by EMS personnel at the scene and on the way to the hospital. Integrated post-cardiac arrest care is the final link. After the person is resuscitated, an interdisciplinary team of medical professionals works to stabilize the person's medical condition, minimize complications, and diagnose and treat the underlying cause of the cardiac arrest. The pediatric cardiac chain of survival is slightly different from the adult cardiac chain of survival. Because cardiac arrest in children often occurs as the result of a preventable injury, such as trauma, drowning, choking, or electrocution, prevention is the first link in the pediatric cardiac chain of survival. The second link is early CPR, and the third link is activation of the EMS system. Just as in the cardiac chain of survival for adults, the fourth and fifth links are early advanced life support and integrated post-cardiac arrest care. 4 out of every 5 cardiac arrests in the United States occur outside of the hospital. When you complete the first 3 links in the cardiac chain of survival, recognizing cardiac arrest and activating the EMS system, immediately beginning CPR and using an AED as soon as possible, you can make the difference between life and death for an adult, child, or infant in cardiac arrest.